Good afternoon. Thank you for joining us for today's webinar, which is Optimizing Financial Outcomes with Revenue Cycle Management. My name is Tony Peterson. I'm the Vice President of Customer Experience here at NexTrust, and I'm going to be your presenter on today's presentation. We'd like you to hold your questions until the end of the presentation so that we can get through the material that is there. On today's webinar, we're going to review the following items. First, we're going to talk about the financial impact of denied claims on your practice. Second, we will discuss the value of outsourcing your medical billing process to another entity. We'll talk about the pros and cons of using only a clearinghouse versus adding on a revenue cycle management service with that. And lastly, we'll talk through some of the tips for selecting an RCM partner that would be best for your practice. So let's jump right into today's content and begin with the financial impact of denied claims. The reason doctors submit claims to insurance companies is obviously so that they can get paid for the service that they provide. They rely on those claims being accepted so that they can collect revenue. However, as all of you I'm sure are aware, submitting claims does not always guarantee that the doctor is going to receive payment for those claims. Unfortunately, many claims end up getting denied. Health insurance claim denials are a major roadblock for healthcare organizations. If you look up on the screen that we've got here in front of you today, there's some really staggering numbers. Over $262 billion in claims are denied every year. If you take that and divide it out by the number of healthcare providers, that equals $5 million in denials per provider. Or 1 in 7 of all claims that get submitted are denied, which means that there's over 200 million rejections every day. 30% of all claims get denied on the first submission, and it costs a practice on average $25 per claim to resubmit that claim. This can create a very daunting picture for many small or even large healthcare organizations who are struggling with decreases in their revenue or reimbursements and trying to make sure that they're running a viable business. If we take a look at the reasons that these claims are being denied, there's some very interesting data here. 32% of all denials are due to improper coding, and 27% are due to improper patient information or registration. Between those two items, you're looking at almost 60% of claims that are denied for workflow reasons or data reasons where there's not, something hasn't been done properly during the intake or the coding of the visit. You can imagine the overall costs for you and your practice to resubmit a claim if you're paying $25 on average to resubmit a claim at least 32% of the time, which is the coding side of things. That adds up very, very quickly. Take 32% of all claims that you submit, multiply that by $25, and how much are you spending per month on claim resubmission? It really does add up. Having an experienced partner to properly submit those claims could save you money, increase your revenue, and save you a lot of frustration in trying to deal with the process of submitting and following up on medical claims. On top of that, there's always changes that are coming to medical billing and coding. As many of you can remember, since October of 2015, ICD-10 has been the standard for medical coding and billing. ICD-10 was a major undertaking for most organizations. In January of 2022, the World Health Organization and its member states implemented ICD-11. ICD-11 has more than 4 times the number of codes that ICD-10 has. And ICD-10 had 4 to 5 times as many codes as ICD-9. The process of billing and coding medical claims is not getting more simple, it's getting more complex. This complexity creates a scenario or a system where careless mistakes that are made by billers and coders, which already exist, can become an ever-growing problem and lead to some of the rejection numbers that we've seen. If practices aren't coding properly, they could potentially be leaving thousands or even tens of thousands of dollars on the table by not coding to the most up-to-date standards. Now, ICD-11 is not something that is in place for the US healthcare system immediately, but there are always changes that are coming, and that's going to be one of those that are coming in the future. So let's talk a little bit about the difference between a clearinghouse versus RCM services. Most practices have a relationship with the clearinghouse of some kind. What is a clearinghouse? Well, and since most of you have them, you probably know, but we'll still take a few minutes to go through that. Clearinghouses are third-party service providers that act as the middleman between the healthcare providers and the health insurance companies. Their primary function is to process and route electronic claims, ensuring that they're formatted correctly and meet the payer's requirements. When a healthcare provider submits a claim to the clearinghouse will scrub the claim to make sure it's complete and compliant. They will then forward the claim to the appropriate payer for payment. If the claim is denied or rejected, the clearinghouse will provide the healthcare provider with information on why the claim was rejected so that the provider and their staff can make the necessary corrections and resubmit the claim. Often this becomes a costly burden, as we stated before, and it costs about $25 per claim to resubmit. So the clearinghouse can provide you some information, but there's still the whole resubmission and follow-up process that you have to go through if all you're using is a clearinghouse. So how does revenue cycle management help you with that? Revenue cycle management has a fundamental goal to increase your revenue. It is a comprehensive solution for managing a medical practice's billing and revenue cycle. The cycle starts from the initial encounter with a patient and ends when all payments for all services have been received. Healthcare providers use RCM to simplify the financial processes for their practice. For example, providers can save time and limit errors by automating appointment scheduling, insurance verification, and billing processes. RCM will also help providers understand financial data better by generating detailed reports and reviewing those reports with you. These reports are crucial when making decisions. In general, if you're utilizing the reports appropriately, it can increase your practice's efficiency. RCM services offer many things like pre-claim services or follow-ups for prior authorization before certain procedures are done, making sure that all of the documentation is necessary in order to submit that particular claim. It also offers you a claims review process where on a regular basis, you'll meet with your RCM provider to determine if there are opportunities to generate additional revenue by meeting the conditions necessary to code to a higher level. They'll also help you with the process of submitting and processing electronic claims, submitting them through a clearinghouse that either we provide or one that you are already contracted with. Those are options that many different RCM providers will offer for you. We also, when we sign up with an RCM provider, we expect that they're going to help with claim management. So that means not only the initial submission of claims, but follow up on rejected claims or possibly underpaid claims, lost claims, anything that happens that would prevent you from being paid for the services that are provided on those claims is managed by your RCM provider. They'll also help you with claim resubmission, where if an error or a rejection occurs, that follow-up and resubmission will be managed by your RCM provider. Most of them will also offer patient statement and billing services, which means that sending out mail, e-bill notices, and working with collection agencies, that's something that you want to make sure that your revenue cycle management company is offering. It's now found that patients owe about 60% of all of the bill for each healthcare visit that occurs. In previous decades, that number might have been 10%. And so it wasn't quite as important to make sure that we were following up on patient statements. But now, when there's a 60% of the revenue that is coming from the patient, if your RCM provider is not utilizing up-to-date technologies and offerings for patient statements, you're going to be missing out on some of the revenue that you need in order for your practice to be successful. Additionally, RCM services will often work with accepting the payments from the patients and offer you a way to offload those processes and discussions that happen with patients related to financial matters. Many practices don't want to spend as much time on the phone talking to patients about questions regarding their statements or their bills. If you're using a good RCM provider, they're going to handle that burden for you, which would then allow you to focus more of your time and effort on providing outstanding patient care. And lastly, a good RCM provider is also going to provide reporting and analytics for you, which allows you to see what your most profitable procedures are, ways that you can improve the efficiency and effectiveness of the claims that are being submitted, and work with you to identify opportunities for additional revenue generation. So why would you want to take such an important process and outsource it to a company that's outside of yours? By outsourcing your medical billing to an RCM service, you can benefit from their expertise and specialized knowledge in many areas, including the ones that are up on the screen, which can help you maximize your reimbursement and avoid potential compliance issues. When maximizing revenue for your medical practice, choosing the right solution for your billing and revenue cycle management is very important. While clearinghouses can provide some assistance with processing and routing electronic claims, they offer a partial solution, and that partial solution can result in rejected or denied claims and delays in payments. The benefits of outsourcing to an RCM service include optimized charges and coding, which means that RCM companies, they'll employ certified coders and medical practice management specialists with deep expertise in compliant coding, reimbursement, fulfillment, and overcoming payer denials. They're going to help you understand how you can submit your claims more completely and get paid more fully and at a higher rate. They're also going to offer you lower operational expenses. Today's greater billing demands mean that practices need to hire more skilled, and by more skilled, that means more expensive personnel. In addition to that, the overhead, technology, and continuous training costs add to the pile of expenses. It may be much more cost-effective for you to outsource your billing responsibilities to an RCM company. They also will offer you maximized reimbursements. Outsourcing can ensure that all patient visits, claims, and charges are accounted for and billed properly. Automated software systems and human oversight secure reimbursement for every service a practice has performed. It also results in faster turnaround times because teams of dedicated medical billing specialists will process large volumes of claims very rapidly, resulting in shorter revenue cycle times between the patient clinical encounters and reimbursements. Simply put, they're dedicated to doing your billing work, and that's all they're dedicated to doing. If you have employees in your practice or you're trying to do it yourself, that comes when they're able to get to that among all the other different duties that you or your employees have. This in turn allows you to provide a much greater focus on patient care. It relieves you and your staff of administrative burdens related to billing and frees you up to focus more exclusively on delivering high-quality patient care. That, in turn, can improve the morale within your practice or organization and increase the likelihood of patient satisfaction, which is very important these days. Healthcare providers use RCM services to simplify their financial processes. For example, providers can save time by automating appointment scheduling, insurance verification, and other processes. Furthermore, automation eliminates the errors that would have occurred if the processes were manual. RCM will help you understand the financial data much better by generating and reviewing with you detailed reports on the claims and statements that have been submitted and paid. These reports are crucial when making decisions for your business. In general, an RCM provider will help you streamline your processes, which increases your efficiency. Experts, if you were able to hire experts in their field, coding, at a much lower rate than hiring them as an employee in your practice, that's going to make you much more effective. Appealing and following up on denied claims can be very, very time consuming, and many practices don't have a lot of time. Using an RCM provider minimizes the number of claim denials, which then in turn saves you time. It also will help you identify errors in your billing process much faster than if you're simply relying on the reports that come back from the Clearinghouse through those regular reviews. Outsourcing your practice's RCM to a medical billing specialist makes it much easier for you to maximize your revenue and efficiency without having to manage in-office staff or technologies. When you use RCM services, you no longer have to worry about office turnover or the headache of training and retraining and continued education for employees on software, industry, coding, any of those. There's no more second guessing whether procedures have been properly coded to maximize revenue because you'll be reviewing those with your RCM provider on a regular basis. Again, this frees you up to focus on providing the best possible patient care to your patients, which is what they're going to use to make the decision as to whether they continue to see you as their healthcare provider. So let's talk about some tips for selecting the right RCM partner. There's certain things that you want to look for when choosing someone to help you with your RCM or revenue cycle management services. The things that you should look for include the items up on the screen. You want somebody that has an experienced and proven track record that can help you with your specific scenario. You want experts in your specialty on the staff with the company that you work with. You want somebody that can work with your medical billing software so that that reduces the burden on your office of having to look for things and learn new systems. You need somebody that provides a fair and easy to understand pricing model. And last but not least, you need someone that provides outstanding service and support. At BillFlash, we offer RCM services. Who are those services that we are working with? We are working with numerous medical practices that are looking to outsource their medical billing needs. So like you, lots of practices like you. We also work with a number of medical billing companies who are looking to expand their service offerings to serve a wider customer base. If you are a medical billing company and you're watching this trying to figure out how does BillFlash work for a company like mine who's providing very similar services, ask yourself, do the 4 S's come into play here? Do you ever have a customer or a potential customer who comes looking for you to support them and provide RCM services on a different software than you have historically provided. BillFlash RCM services work with medical practices and billers that are familiar with just about every EMR application on the market. There are also numerous differences from state to state when billing medical claims. No matter where you're located, BillFlash has licensed experts in all 50 states. If you are a billing company who's providing services in a limited number of states, and you have referrals that come over from states outside of your area of expertise, we can help you fill that gap. Specialty is a very big one. Each medical specialty has its own set of codes and types of claims that are submitted, and they all have their own independent rules around how those claims are submitted. What are the different modifier sets? Is one of the very basic questions that you would have to ask yourself. What is the documentation needed to submit certain types of claims? If you have a specialty that is very specific, chances are BillFlash RCM services will cover your specialty. There are very few that we don't have any coverage in. If you're an RCM provider and you've really focused your time on one particular specialty, but you have customers that come to you looking for help in other areas, and you're not able to provide that expertise, BillFlash RCM services will let you go out and offer those services to those customers. And last but not least, the last S out of the four is the size of the practice. BillFlash RCM services work with a wide range of sizes of practices, everything from single provider practices up to hospital systems. Our experts are working with all different sizes of practices. So you can rest assured that if you have questions in any of those four areas, we will be able to help you. And if you are a billing provider who's looking to work with a larger range of customers, ask yourself if there's any room to expand in those four areas by working with a company like NexTrust and our BillFlash RCM services. So let's talk about the revenue cycle that we're providing. It really is a cycle that starts with the service delivery, where a patient appointment is taking place and documentation is happening during the appointment of billable charges and ensuring proper coding. So that means you're either entering those charges through the note in your EHR, or many practices are still utilizing a super bill where they select the codes that are for the procedures and diagnosis codes that are relevant to a particular appointment. That leads to the start of the claim, where our experts will handle the data entry of that claim and work on error identification and mitigation before those claims are submitted. When those claims are submitted, we will review them and make sure that you're coding to the highest level possible. We will have conversations with you. We're not going to change a code for you, but we'll let you know, hey, if you visited with the patient or had the visit last another 5 minutes and asked the following questions, you might be able to use a different code that would get you paid a higher rate. We're also going to ensure that you're submitting the most accurate claims possible and track the status of those claims. The whole purpose of submitting the claims is so that payments come in. So after the insurance claim is accepted and paid, we'll focus on the patient billing, the payment acceptance from the patient and the insurance company. We'll handle AR management for you. We also offer an integrated collection service where if a patient is deciding not to pay, we can work with a collection agency to help ensure that you're receiving as much of those payments as possible. And then once the payments have come in, we will provide you with data and analytics that help you begin the next cycle more effectively. We'll give you performance reports with data tracking and monthly insight meetings that are designed to maximize the revenue that you're getting out of your claims and the services that you're providing. Our services cover every step of the payer journey, including billing, pay services, collections, and RCM. Revenue cycle management services, such as those offered by BillFlash, provide a range of services that can help you maximize your reimbursement, reduce denials, and improve the efficiency of your practice. Additionally, our flat rate pricing model per physician can make RCM services a very cost-effective and attractive alternative to a clearinghouse-only option or using in-house billing. So if we look at the different things that BillFlash RCM services will help you, they'll help you simplify and focus by eliminating back office distractions, costs, and headaches while your team focuses on healthcare. We'll help you with pre-claim services that lay the foundation for a payable claim before the patient encounter even begins. We will work with you on claim review and submission, helping you collect every dollar you earn by having experts in your specialty review each claim. After the claims have been submitted, we will manage the claims for you, helping you achieve superior payment results, reducing the denied claims, and following up with insurance carriers regularly on any claims that were unpaid or underpaid. We'll help with the patient billing using your BillFlash billing services in accordance with your engagement protocols, meaning we're sending out the claims, or not the claims, the statements, the electronic notifications of statements, and other options of notifying the patients of their responsibility in facilitating those payments back to you. Patient collections, as we talked about, taking care of those collections with an integrated collection service that works according to your protocols and how aggressive you want them to be, and providing the analytics and reporting that we talked about before. This has been an overview of the not only BillFlash RCM services, but why you would want to consider utilizing an outsourced RCM provider. You need to make sure that you're taking care of your practice effectively. If anything that we talked about today resonates with you or is interesting to you, if you'd like to learn more about it, you can schedule a demo at billflash.com. There's a link up in the top to schedule a demo and talk to our representatives about the services that we offer. Our phone number is 435-940-9213, or you can email us at getpaid@billflash.com, and you can connect with us on any of the major social media platforms. Thank you for joining us today. We look forward to speaking with you again soon.